With the World Health Organization walking back those comments on asymptomatic COVID cases, what's the real story?
Joining us to break it all down, family physician Dr. Jennifer Caudle. Dr. Caudle, let's listen to the walk back right now one more time and then get your response on the backside. Take a listen.
It still appears to be rare that an asymptomatic individual actually transmits onward. We do know that some people who are asymptomatic or some people who don't have symptoms can transmit the virus on. I wasn't stating a policy of WHO or anything like that. I was just trying to articulate what we know.
Okay, so doctor, you have to guide your patients with this guidance from the WHO. How do you make sense of all this?
Absolutely. Well, I have to be honest with you. When I heard the comments that asymptomatic transmission was very rare, I was surprised, just like the rest of the world. So I actually listened to that entire press conference where the statements were clarified. And this is what I gather from what she said throughout the whole thing, and also what I am telling my patients. A few take homes. First of all, asymptomatic COVID infection is still happening. Let's not think that it doesn't. And asymptomatic infection, by the way, is this idea that you have COVID, but you may not know it because you don't have symptoms. Now, asymptomatic transmission, the ability to spread COVID when you're asymptomatic, we know still happens. That's one of the things that was in question. Now, the researcher, when she kind of clarified her comments later on, what she said was that when she said the comments, asymptomatic transmission is very rare, she says, I was referring to a small subset of studies and some other data that they had. She said actually that it's a misunderstanding, and I'm just reading my notes, to state that asymptomatic transmission globally is rare. If I can just make one more comment before we move forward. I know people are probably saying, well, how is asymptomatic transmission very rare when there were people telling us that 30 to 40% of asymptomatic infections were able to transmit it? And what she said about that is the data that you look at. She was looking at a small subset of studies that showed very rare transmission from asymptomatic folks, whereas those studies that suggested 30 to 40% transmission were done by modeling. So the bottom line is here, if the numbers are sort of confusing in this and that, nothing has changed in terms of asymptomatic infection and transmission. They still happen. We still need to be wearing our masks and doing all the preventative things that we had been doing. The issue is we just don't know how much asymptomatic transmission is happening, because that's something that still needs to be further studied. So right. I hope that's helpful.
So I have a question to that then, and I don't know. Yes. Forgive me if I should know this, but I just feel like okay. There's been a lot of information that's gone back and forth. So yes. How is asymptomatic transmission happening then? Because obviously, if you have someone with symptoms, they're coughing, they're sneezing, this, that. I think one can assume if someone near you is coughing, maybe back away from them. But how is it happening asymptomatically then?
So your question actually is a wonderful question. It's a question that a lot of my patients are asking me and a lot of people are wondering. So it's an excellent question. So this is how we think asymptomatic spread happens, because you're right. You're not coughing or sneezing or this, but things like heavy breathing. So maybe somebody who's going for a run or exercising that's panting, breathing hard without a mask, there's sort of this forced expiration, right? And particles are able to still be expunged that way. There's also things like singing, right? That could be a way that particles are sort of expunged from our nose or our mouth, or even forceful talking. And not just those ways, but let's say somebody is asymptomatic, but they're infected with COVID, they don't know. Let's say they touch their nose or their mouth or their eyes, and then they touch a surface that someone else then comes behind and touches after them. That is a way that the virus could be transmitted. So that's an excellent question, actually. Those are some of the ways that we think that asymptomatic people can transmit the virus.
Okay. Bottom line is there are still a lot of questions, but Dr. Jennifer Caudle, thank you for joining us with that information and clearing it up for us. We appreciate it.
Thank you.